what is the recovery like after gynecomastia surgery? When can I go home? When can I go back to work? When will I be able to work out again? When will I see the full result? To explain all this in detail, I'm Dr. Aniketh Venkataram, plastic surgeon, Venkat Center, Nearby Aesthetics, Bengaluru. Now, to start with, gynecomastia is a condition wherein there is an overgrowth of breast glands in men. This happens when there is a hormone imbalance in the body. The most common cause for this is during puberty. Unfortunately, even when the hormones come back to normal, gland does not go away and you cannot burn it away by gym and dieting, which is why surgery is needed. To know more about what is gynecomastia and why it happens, you can see our other video on this topic. So now we know that the only way to get rid of gynecomastia is by surgery. Now, obviously, when it comes to surgery, you need to plan how to go about it. So let us talk about that. Let me start by saying that our recovery and what I am about to tell you is a lot different from most other places. This is because we do gynecomastia surgery under local anesthesia. Most places is done under general anesthesia. What this means is we only give anesthesia to the chest area. We do not make you unconscious. You are fully awake during the surgery. We do it this way because one, it makes the surgery very, very safe. You're avoiding general anesthesia and you're also avoiding the bad complications of liposuction. Two, I can make you stand up in the middle of the surgery, see how it's looking, make you lie down, do some more. This helps me give a better result. And three, it makes your recovery very, very easy. You walk out of the operating room and the complications are fewer. Again, to know more about how we do this under local anesthesia, you can check out our other videos. So now let us come to the actual point. What is the recovery like? So you pick a date. You come, get the surgery done, go home the same day. There's no admission or anything. You walk into the operating room, you walk out of the operating room. The only thing is we don't want you to be alone after the surgery. So if you're coming from some different city, you're staying in a hotel, you don't have anyone with you, then we'll keep you in a hospital for one night just so that there's someone to look after you. But if you have someone with you, you can go back with them to their hotel room or their house, whatever it is. This is just for your safety. Now after the surgery, there is a big bandage around the operated area. You need to come for 2 days to get the bandage changed. So if you do the operation today, you have to come once tomorrow, you have to come once day after tomorrow. So we recommend that these 3 days, you take some rest. You're not in bed. It's not like you cannot walk around. You can walk around and move around, but we don't want you to do any strenuous activity, lifting any heavy object, anything like that. The 3rd day after the surgery, you can go back to work. There are no more bandages. We'll be giving you a compression garment that's like a tight bunion that you wear inside your clothes. You have to wear that for around 1 month after the surgery. You can wear it inside your clothes, no one gets to know that you're wearing it. So 3 days after the surgery, you can go back to work. But you cannot yet start driving. We don't want you driving a two-wheeler. We want to give rest to this area so that it heals very, very well. Another thing that makes our recovery very easy is that we don't use drains during our surgery. This is because we're able to make you stand up and do our dressing in a standing position. So we're able to squeeze all that fluid out. There is no need to use drains. This again helps with your recovery. So you can see that you're back to work within 3 days. You walk into the OR room, you walk out of the OR room, and you feel pretty good the same day itself. So this was the first few days after the surgery. After 1 week, you can start brisk walking. You can start driving a car. After 2 weeks, you can start driving a two-wheeler and you can start doing proper cardio and you can start mild weightlifting exercises. Chest exercises, you still need to take it a little bit slow. After 1 month, there are no restrictions. You can do whatever you want, including chest exercises, heavy exercises. So this was your recovery in terms of you getting back to normal. When are you going to get the full result? You're going to see a noticeable reduction in size within a couple of days itself. But skin contraction is what takes some time. At the Venkat Center, we don't like to surgically remove skin because that leaves a large scar which is noticeable by people. Our aim is that people shouldn't know that you've had this surgery done. So we use a technology called Body Tight which helps in skin tightening. We make one small hole near the nipple, one small hole in the side, and we do our entire surgery through these 2 small holes. So no one gets to know that you've done anything. So this Body Tight technology for skin tightening is what takes a little bit of time. By around 1 month, you will have most of the result. By around 3 months is when you will have 100% of the result. So it takes a little bit of time to get the full result, but you see a noticeable difference within a couple of days itself, and most of the result happens after 1 month. Here you can see some photos of our patients at various stages of their recovery. I hope this video was informative for you. If you have any questions, do get in touch with us. Do like, share and subscribe. Thank you. Have a great day.